Hi guys, let's begin with the next chapter, that is of RNA part, RNA viruses, and that includes the Rhabdoviridae family. So of course rhabdo, everyone thinks of rabies at the outset, but it has a couple of other things. It actually has two genus under it. One is the genus Lisa virus and the other is the vesiculovirus. Vesiculovirus is very simple because the name of the organisms under it is also vesicular stomatitis virus. So easy, vesiculovirus is the family and vesicular stomatitis virus is what we have. On the other hand, the genus Lisa virus is what is of concern to you because all of us read rabies, right? So let us start off with rabies, that is the more important one, and in the end we'll go to the vesicular stomatitis virus, just touch upon it with 2-3 words. Let us start off with rabies. Of course, we all know that the question that has come a million times in the exam but is also known to a million people is that it is a 100% fatal disorder. Yes, 100% fatal, very famous PYQ that it has. What are the things that I have already taught you about rabies, and that is the shape. If you remember, I showed you the electron microscopy earlier, and it shows you a classical bullet shaped virus, and I always used to say the bullet is also going to kill and rabies is also going to kill. That is how we had learnt it. Also, what you see that is projecting out, I can definitely see an envelope around it. So is it an enveloped virus? Yes, it is. So talking about its shape, it is bullet shaped. Talking about the envelope, it is enveloped, and it is a negative sense RNA. So now all the RNAs are single stranded, so rabies is also single stranded. That's okay. But what are the RNAs or what are the viruses which are negative strand? If you remember, Mr. Fab was negative sense. We have already studied the Microbiology family, that was negative sense. Now comes the Rhabdoviridae family, and rabies, that is also going to be negative sense. We will be reading the Fab also eventually. So remember, the Rhabdoviridae is also a negative sense RNA virus. Okay, so that is how it looks like. It's a bullet, and can you see something projecting out of it? There is something called glycoprotein. So you will ask me, what are the antigens? Number one antigen that I can see projecting out of it, the main one is going to be the glycoprotein. Apart from that, I can also see a ribonucleocapsid or a nucleocapsid wala protein coming inside. The main one is this glycoprotein, see, which is on the surface of the bullet. The glycoprotein spikes are the ones, they are the ones which are antigenic, they are the ones against which antibody will be produced, they are the ones which are going to cause that neuroinvasiveness. So they are the ones which are involved in the entire pathogenesis and the neuroinvasiveness. It is this glycoprotein. So I have divided the antigens in two columns. One is a glycoprotein G, which I'm giving all the importance, which is over here in front of you on the surface. Another is inside, which is the nucleoprotein. So that I've kept on the other, which is less important. So what did I say? Where is glycoprotein G present? It is present in the envelope. Is it going to be species specific? Yes. This is the one that is going to go and bind onto the receptor. Which binding happens? In rabies, there is binding to the acetylcholine antigens or receptors. Fine. And if it is the antigenic part, means the antibody is also produced against it. And if this is so antigenic, this means the vaccine that I'll be studying in the end is also related to glycoprotein. So sub main function goes to glycoprotein. Na? It is binding also the work this is being done by it. Antibody production is also against it. Vaccine preparation is also against it. Whereas nucleoprotein is pretty useless. Just a way of learning that nucleoprotein is not in the envelope. Where is it? It is associated with the viral RNA, nucleo-RNA. It is not species specific, it is group specific. Does it have any role in binding to acetylcholine receptor? No. Does it have any antibody role? No, it does not. Is it going to be used in the vaccine? No, it's not. In fact, it is so useless that it is going to also cross-react with other viruses. So that is why it's not at all specific. Na? If it can cross-react with other antibodies of other viruses, then I can't use it even for diagnosis or for vaccination. So the main antibody coming back for the binding, for the antibody response and the vaccination, and also for the neuroinvasiveness is glycoprotein G. Done with the structure, I think now we can start off with the pathogenesis, right? But before I start off, I just want to tell you that there are two types of viruses that you have. Pehle rat lete, then we'll go to the understanding part of it. Street virus, fixed virus. So street virus is the one that causes street pe people a street fight hota hai, furious, okay, street pe street fight. So that is going to result in the furious rabies. And fixed virus, firstly let me tell you, fixed virus is basically produced when the rabies is grown repeatedly in the brain of the rabbit. So remember, when the rabies is grown repeatedly in the brain of the rabbits, that is when we get a fixed virus, and fixed virus is responsible for number one, dumb rabies. If it is naturally occurring, it will cause dumb rabies, and this is the one which I am going to use for vaccine preparation. That is why I am passing it so many times through the the animal brain, because I'm going to use it for vaccine preparation. So remember, over here you will not see, because the vaccine preparation में use होता है, this is not going to go and form any negri bodies. The street virus, which is street fight, that is furious street fight, that causes furious rabies, that is going to go and cause negri body formation in the brain. This was just a ratta that you had to do. Now we are going to go on and study about the pathogenesis. So what have I done over here? I have got you a little bit of a chota sa fill in the blank kind of a thing, because after that I will also show you the diagrammatic representation over here. So pehle to I can see there is a dog. It could be a dog or any other animal, a dog or a cat or a monkey or a bat. And over here they've shown you biting, but biting is not essential. What all can be the spread? So please remember, it could be dog or a monkey or a sheep or a goat or a cat. Understood. It could be a bite or a lick. Understood. This everyone knows. But what else? Dog bite, lick ho gaya, theek hai. It could be just a lick on an abrasion. Maybe you've got some minor cut or a minor cut or wound, and a rabid dog comes and licks over it. That is a big time exposure. Second, you will say that bats ke saath kaise hota hai? Bat is not gonna come and bite me. So how is the exposure with bats? So please remember, infected bat aerosols, if we end up inhaling them, that is also one of the routes. And one more thing, corneal transplantation is also going to be one of the methods by which rabies can spread, and you will know why when I tell you the pathogenesis, because rabies virus goes in some parts of the bodies and sits, like it's the skin, like it's the salivary gland, like it's the cornea. So rabies virus tends to go and sit, and if that person's cornea is transplanted onto someone else's, then that means that there is a risk of rabies transmission. So like I said, the life does not depend only upon bite or lick. It is associated with bat aerosols also, it is associated with corneal transplant also. So, but for all practical purposes, we learn it with a dog bite, and we can see, abhi I'm telling you a very, very quick method, then abhi I'm not writing anything. I'm telling you everything in a verbal manner, then you're going to do fill in the blanks with me, okay, like we used to do in school. So what is the first thing that has happened? The first thing has happened over here is that the dog has come and bite. If the dog bitten the person, okay, so obviously where has he bitten? He has bitten in the muscle, so muscle mein replication hoga. And where is the virus going to go and bind? It is going to bind to which receptor? I've been telling you again and again, it binds to the acetylcholine receptor. And I can see that after entering the nervous system, where is it going? It is going backward from the nerves, acetylcholine receptors, it is going to the spinal cord. Basically, the kind of movement that it's having is going to be retrograde. And where is it trying to reach? It is basically trying to reach the spinal cord and the brain. So it is going what direction, ma'am? It is going center mein. It is going centripetally. After going centripetally, brain mein kya banega? Kaun sa wala bodies are formed? We all know in the brain there is formation of negri bodies, and after formation of negri bodies, what will happen? Brain involved ho gaya. Now it will go on its journey outside. Outside journey, where all can I see? It can go in the eyes, means it can go in the cornea, as I could notice. Then I can see it can also go in the glands, and let me tell you which salivary gland is very commonly affected. It is the submaxillary salivary gland. Submaxillary salivary gland is very commonly affected, and it can also go to the skin. That is why they say that if you want to do the diagnosis, take a skin hair follicle from the neck, because skin may be jata hai. So overall, the main points were the virus first comes in the muscle, it gets attached to acetylcholine receptor, it goes in a backward direction movement, that is retrograde. So centripetally it is going all the way to the brain. From the brain it makes negri bodies, then it goes out to the cornea, to the salivary gland, and to the skin. Now can you fill in the blanks with me? Can you tell me where is the virus getting inoculated and multiplying? Obviously the bite is happening in the muscle, leg or arm, wherever over there. Which receptors is it going to bind to, guys? Of course it will bind to the acetylcholine receptor. After binding, aage ja raha hai ya retrograde ja raha hai? Of course it's going retrograde. It is a Retrograde axonal transport, where is it going to spread? It is going to spread which center mein ja raha hai ma'am, it is going towards the brain. So basically it is spreading centripetally, and where is it going to reach? First it will reach the spinal cord, then it will go to the brain. That is exactly what I have written. It is finally going to reach the spinal cord, and then it is going to reach the brain and cause Negri bodies. So spinal cord mein agar exactly pucha what ganglia, dorsal root ganglia. That's the question that you have to know. Brain में क्या बनेगा? Negri bodies. These are the questions. Fine. After reaching the brain, it had to spread where? It had to spread centrifugally. Where has it spread? I told you it goes to the cornea, the skin, and the salivary gland, and that story is exactly in front of you. So now if I ask you three last questions. Question 1, what was the receptor? Receptor acetylcholine. Question 2, where in the spinal cord? Dorsal root ganglia. Question 3, where in the brain, or what does it cause in the brain? It is the Negri bodies. So pathogenesis is done. We are now ready for the clinical features. So tell me, all this spread that was happening, retrograde, spinal cord, axonal, so much, what is the speed of that spread? So we'll learn it in terms of per hour, and that's a very famous question, 3 mm per hour. 3 mm per hour is the speed. A lot of times it has been asked. If it's traveling from the leg all the way up till the brain, it's going to take a longer time. But if it's traveling from the forearm till the brain, it's going to take a shorter time. Second, if you are 6 feet tall, from your leg to your brain, it's going to take a longer time. If someone is 5 feet, then it's going to take less time. So there are factors. Everyone is not going to have rabies reaching the brain in the same, in the same duration. This means this timing will be shorter in case you have something like a person who's having a shorter height. So obviously in that the time taken for travel will be less. Secondly, if the person is having an upper limb bite, because upper limb bite will reach more easily towards the brain. And thirdly, if it is a child, because children are anyway chota in height, na? So remember, in these three situations, what happens is that the speed 3 mm per hour hoga, but the time taken to reach the brain is going to be shorter. Okay, what are the clinical features? We have divided it into 3 phases. One is the short prodrome, which happens with almost every disease, right? We all know, which lasts for approximately 2 to 5 days. Then finally comes the neurological phase, which I'll be talking about in detail, and that lasts for approximately another 2 to 7 days. And finally, that is going to result in coma and death, and we all know it is a 100% fatal disorder. So देखो, prodromal में तो वही usual things happen, which is nothing very fancy. Neurological phase is going to be quite interesting. So I have divided it into 2 types. One is known as the furious rabies, one is known as the dumb paralytic rabies. So now let me tell you, furious rabies mein 80% of the patients are going to have furious rabies only, and it is said to be the encephalitis rabies. This means there is a phase of encephalitis. The patient is, what is encephalitis? You all see there are 2-3 things about rabies which even like non-medicos know. There is hyperexcitability, one feature that you know, patient becomes extremely excitable. Secondly, there is hydrophobia, right? Difficulty in swallowing water. This is something which everyone knows. First is phase of encephalitis, which is going to be hyperexcitability. Then for a short duration, there is a slight improval. There is a slight improval, and that is known as the phase of lucidity. That is known as the phase of lucidity. And finally comes this last stage called stage of autonomic disturbances. This is where all your the heart rate, the BP, the organs, the autonomic system starts getting affected. And finally, this is what you were asking for, hydrophobia. So what happens? The patient himself is going to hypersalivate a lot, but he's always going to have a difficulty in drinking water. There is hydrophobia and there are arrhythmia. So autonomic disturbances have started. So simple, pehle encephalitis with slight improval because your body is trying to fight, and finally comes the phase of autonomic disturbances. That is the furious encephalitis rabies seen in 80% people. Now we have the dumb paralytic rabies, in which I've already told you that there is gonna be a level of paralysis present but no cardiac. Matlab autonomic symptoms come hai. The word only tells me that the primary focus is gonna be the paralytic symptoms. And who has these? These are the ones, either they are the ones who are partially vaccinated, or it is associated with rat bite. So remember dumb rat. Remember dumb paralytic polio is very commonly seen with rat bites and the partially vaccinated people. Iske andar paralysis is what is going to be quite evident. How do I do the lab diagnosis? Same, do an antigen, do an antibody, do isolation, do testing, do some molecular studies, the same thing. So how am I going to do the antigen detection? We always do it by DIF. direct immunofluorescence. But the question over here is, from where will I take the specimen? You'll say, ma'am, the virus had gone to the brain. A brain biopsy to lena is not good. After that, the virus came to the eyes and the salivary gland and the skin. Now, cornea you can't take. Salivary gland is also difficult. Skin you can take. So can I say that from the nape of neck, if I take a 5 to 6 mm ka sample, or rather than learning the the dimension, you can say from the nape of neck I am interested in the follicles, and they say that at least 10 follicles should be collected. Which follicles? Hair follicles. I am interested in taking hair follicles, and that is said to be the best sample in which I will get the antigen detection by direct immunofluorescence. However, in later stages, guys, of course, you can even take the corneal impression. That is in later stages. But what is always, now tell me, what is always the most sensitive and specific method? Ma'am, nothing can beat a polymerase chain reaction. That is genetics. And if it is an RNA virus ke liye what kind of polymerase chain reaction do you always use after COVID? That should not even be a question, because even layman knows what PCR is used, and that is RT, reverse transcriptase PCR. That will be the most sensitive and specific. So for every organism, number one, I do antigen detection. By DIF I've done, I took sample from the nape of the neck follicle and ho gaya. Then I've done the most and the best one, that is RT PCR done. What about isolation? Of course, we have to do that also. We are gonna, I've already told you, we're gonna inoculate it. See, in humans, you were seeing negri bodies in the brain. So if you want to see the same in an animal, inject it in the animal. An animal ka brain. So brain of suckling mice will also show you negri bodies. I hope you remember negri bodies were what? You studied this in the first chapter of virology. They were intracytoplasmic bodies. If animal is not available for virus isolation, what do? Ma'am, we always have cell lines. Secondary cell line le lo, continuous cell line le lo. I've just got you some examples. You don't have to learn this. I've got you like ek primary ka, ek secondary ka, and ek tertiary ka, ek continuous ka example, right? Only for your testing your knowledge. Okay, chick embryo cell line. Primary or secondary? Ma'am, whenever embryo word comes, this is primary cell line. WI38 and MRC5 were secondary cell lines, and BHK cell line was continuous. This is only for your testing that I got, that okay, if you either you can use an animal study or you can do a cell line study. So everything, antigen I did, PCR ho gaya, virus isolation ho gaya. I did not talk about antibody testing, because you might want to run away after it. That is why I saved it for the end. Antibody testing. Firstly, where all will rabies ka antibodies form? Of course, they will form in the blood, but since this is also a neuroinvasive disease, it happens in the CSF. So let me tell you that actually the blood antibodies have a disadvantage, that they appear late. Number one problem. Second, blood antibodies are going to be present in vaccinated people also. Someone who's been priorly vaccinated for rabies, they are going to be present in vaccinated persons also. So I believe that CSF antibodies are more valuable. They are more valuable as they are not seen in vaccinated people. So if someone starts showing me CSF antibodies, this means that person has been infected with rabies. That is why CSF samples are considered better for testing the antibody. How are the tests done? There are so many short forms in front of me. What are the short forms that I've heard of? Maybe I have heard of CFT, complement fixation test for antibody, yes. Have I heard of HAI, hemagglutination inhibition test? Yes. IFA, indirect fluorescent assay. Ma'am, yahan tak to we have studied a lot. So, okay, these three have saved me, that indirect fluorescent assay and hemagglutination inhibition test and complement fixation test are antibodies. What are the others? The others are going to be, again, you don't have to know the full form, but at least you should be knowing that somewhere you have something that is hinting towards an antibody. Like for example, mouse neutralization test. Neutralization is antigen antibody. RFFIT, rapid fluorescent focus inhibition test. Fluorescent testings and inhibition testings are done for antibodies. Then fluorescent antibody virus neutralization test. Wherever antibody and neutralization words are coming, MNT, RFFIT and FAVN, these are also antibody testing. Thoda tough hai, but yes, it's there. Finally, if the person dies and if 100% fatal disease hai, there will be an autopsy that is done. And what will you see in the brain of that person? You will see the famous negri bodies. Do you know any special stain for negri bodies? So number one, there is something known as the Sellers stain. Again, a PYQ. Please note it. Sellers stain. And there is also an immunoperoxidase method of stain that can be done for the negri bodies. and also another immunoperoxidase stain that can be done. But the cellular stain to super duper important for negri bodies. Do not ignore it at any cost. Okay, so before I end this, I would have ended it over here because that is pretty much what microbio has, but I want to correlate this with also how are you going to treat a patient if someone comes to you with a dog bite. So I have got some 5 slides, but that's purely PSM. So my advice is if you've gone through PSM, don't waste the next 15 minutes of your life. If you've not gone through PSM, continue with me. So what if someone has a dog bite? First, you have to categorize a person into categories, right? Category 1, 2, 3, and then you will decide whom to give a vaccine, whom to give an immunoglobulin. बहुत simple है. Students really stress over it. It's nothing to stress over. Please note. Category 1 means that your everything is intact. You are like no abrasions, no cuts. बिल्कुल सब कुछ intact है. If some rabid animal touches you or you end up feeding that animal or that animal is having any kind of contact. See, it's a rabid animal. He is having a problem, but you are totally intact. So you are falling under category 1, and all that you have to do in that case is a wound clean. That is, whatever area has come in contact, you clean it. Wound toilet karna hai, that's about it. However, if you had some very, that dog has ended up scratching you, कुछ nail से scratch करा है, paw से scratch हुआ है, or the tooth has just scratched, there are minor scratches, minor abrasions, the rule being that there is no bleeding. That means that there is category 2. What are you going to do? You're going to, of course, clean the wound. Wound toilet is always going to be done, but along with that, you are going to give the patient vaccine. I'll tell you the vaccine regimes. Now comes category 3, matlab 1 को severe कर दो और 3 को severe कर दो. Means now we say that if some rabid animal has touched not your intact skin, if the rabid animal has come in touch with your abraded skin, matlab 1 ka severe version. Second, not minor scratches or abrasions, some proper bites, transdermal scratch, transdermal bite, proper bleeding. Now it becomes category 3. So simple was, category 1 was that you were intact and you came in touch with an animal. Category 2 was minor scratches. And if you make these two little major, instead of intact skin, you make it broken skin. Instead of minor scratches, you make it bleeding wala proper transdermal bites. Everything becomes category 3. Plus, if you have exposure to any kind of wild animal, all wild animals, that is category 3. What do you do in category 3? Wound toilet, of course you have to do, means you have to clean the wound. You have to give the vaccine like in category 2, but you will add the immunoglobulin. So simple, category 1 में सिर्फ clean करो, category 2 में you add the vaccine also, category 3 में you give everything, vaccine, immunoglobulin, everything. So let's read one slide on these. Firstly, what do you mean by wound toilet? You are going to wash that area. What do you use for washing? All that you have to use is soap and water, and the duration of that washing is going to be roughly 15 to 20 minutes. After you are done with this, you are going to apply something like, say, a povidone iodine or some topical iodine has to be applied over that area. Is that okay with everyone? Just wash with soap and water for 15-20 minutes, apply iodine, your wound toilet is done. This is for which kind? Wound toilet is done for all categories, whether category 1, 2 or 3, cleanliness comes first. Next, let us move on to what do we do in case of a vaccine. Vaccine कब था? Ma'am, 2 and 3 में vaccine देना था. Okay, firstly, there are a lot of vaccines. Some cell culture vaccines are there in the market. Neural vaccines are there. Let me tell you, neural vaccines are so obsolete. Now what we have is the human diploid cell culture vaccine. Okay? So now we use the human diploid cell culture vaccines. That is what is used. And what is the site? That depends. If you are dealing with an adult, you are going to give this injection in the deltoid. If you are dealing with a child, you can give it in the anterolateral part of the thigh. So adult में deltoid and child में anterolateral part of the thigh. There are two regimes, the intramuscular and the intradermal. देखो, पहले तो the confusion is which is muscular, which is dermal. तो thigh red, you will have to see the last alphabets. So thigh red ends with D, so this is the intradermal, or you can also learn that thigh ka I and red ka D makes it intradermal. Whereas Esen. Esen is E for I जैसा sound करता है, intra and N sounds like M. So this is gonna be intramuscular. पहला याद हो गया that thyroid is gonna be intradermal and esen is gonna be intramuscular. After that, how many alphabets does esen have? 1, 2, 3, 4, 5. And how many alphabets does thigh have? 1, 2, 3, 4. So which is the one in which you will call the patient for 5 visits and which is the one in which you will call the patient for 4 visits? So now listen to me. In E-sense, you will call the patient for 1, 2, 3, 4, 5. 5 visits on what day? 0, 3, 7, 14, 28. These are the 5 visits, and on every visit, how many doses did you put? 1, 1, 1, 1 dose. So total kitna dose kara? Total you did a total of 5 doses. So ESSEN, 5 alphabets, 5 visits, 5 doses, khatam. 0, 3, 7, 14 and 28. Whereas thyroid was intradermal, THAI, there are gonna be only 4 visits. So how do you write it? You are gonna write it as, तो 0, 0 दोनों में था, 3rd day दोनों में है, 7th day दोनों में है. Basically the 14th day is skipped in thyroid. Thyroid में 14th day नहीं है and 28th day is there. So please remember, in thyroid you don't have the 14th day. So 0, 3, 7 and 28. And on every one, on every visit, how many vaccines are you giving? 2 doses. So total कितना हो गया? Total 8 doses are given. So please remember, SN में everything was 5 alphabets, 5 visits, 5 alphabets, 5 visits, 5 doses, 1, 1, 1, 1, 1. ठीक है? Whereas thyroid में you have 4 visits, तो कम कर दिया, 4 visits कर दिया, but in 4 visits you will have to compensate ना, so you're going to give double doses, you're going to give 2 doses, that is total 8 doses are given. Everyone's clear with these 2 regimes? Yes. Now you also need to consider, what if a person is a healthcare, not a healthcare worker but a veterinary worker. What if a person is a vet or a forest worker? He says that I will come in contact with animal. Pre-exposure prophylaxis kuch de do. So you will say, acha, how many visits should I call him beforehand? Pre has 1, 2, 3. 3 alphabets, 3 days or 3 visits, 3 doses. That is all that I'll do. So I have done 1, 1, 1. How many doses? I've called him on 3 days. I've called him on 0 day. I've called him on 7th day, and either it can be 21 or 28. And on every day, I have given him a 1, 1, 1 wala dose. So simple. Pre has 3 alphabets. So 3 doses, 3 visits, and that is what you will do. Either you can give him the intramuscular wala regime or you can give him the intradermal wala regime. However, if there is re-exposure matlab how many alphabets? 2 alphabets. So how many days will you call him? 2 days. How many doses will you give him? 2 doses. So re mein kya hoga? You are gonna call him on 2 days, that is 0 and 3rd day, and you are gonna give him 1, 1 vaccine or 1, 1 dose. But now you will also ask me, whom do you define as a re-exposure prophylaxis? What is the criteria for defining someone as re-exposure prophylaxis? So you will say, for example, the person had just gotten bitten by a dog, and I gave him that wo pura, ma'am, we have already done that, whatever SN or thyroid regime has been done and whatever has happened, but within 3 months. So for example, if the post-exposure prophylaxis was given, and after that, if there is a re-exposure, again he's had a dog bite within 3 months, all that you do then is a wound toilet. That is something latest that they are saying. But if he has a dog bite after 3 months, then you will be giving this re-exposure prophylaxis. Then you will be giving this re-exposure prophylaxis. Of course, there are a lot of variations and around this, but I think the easiest way that I could learn it was pre had 3 alphabets, so pre-exposure mein 3 visits, 3 doses, and re has 2 alphabets, so 2 visits mein 2 doses is what you will be giving. Finally, you said that acha, vaccine was to be given in 2 and 3, but where were you giving the immunoglobulin? We had studied in all class 3, the major category that you had, they had to be given immunoglobulin, and let me tell you, immunoglobulin comes from 2 sources, either from the horses or from the humans. Equine immunoglobulin, human immunoglobulin. Human to apna hai. So who is going to give you lesser side effects? Of course, human immunoglobulin is going to give you lesser side effect, and you need a lesser dosage at 20 international units per kg. Whereas who is going to have more side effects? The one that has been prepared from the horse, that is equine, and you will be needing that at a higher dose also, that is 40 international units. So apna one is going to be needed at a lower dosage, and apna one is going to have a lesser side effect. But where do you give this rabies immunoglobulin? It is usually infiltrated in or around the wound. Maximally you have to try that maximum amount of immunoglobulin is infiltrated in or around the wound. If something is left, then you can give it intramuscular, but primarily try that maximally you infiltrate in and around the wound only. So if I take you all the way back to the categories, I think you are sorted. Category 1 में वही soap water wash करो and iodine, that's it. Category 2 में soap water wash iodine तो you have to do, plus you have to do the vaccine, either SNs or thyroid. In category 3, same soap water iodine with SN or thyroid with immunoglobulin, which is going to give you lesser side effects, human immunoglobulin. And finally we wrap up rabies with that, which was belonging to the genus Lisa virus, but I'm not done with the genus vesiculovirus, and I told you it causes vesicular stomatitis virus is coming under it. So let me just tell you, the vector is going to be the sandfly. Do you remember what else was caused by sandfly? I will ask you in a while. Okay, so the vector is a sandfly, and the reservoir are all domestic animals like horses, sheep, the ones which are grown in farms and all domestically. So reservoir are domestic animals and sandfly is going to be the vector. What all does this patient have? You will say, ma'am, I can see vesicles, and stoma means mouth. So vesicles are seen in and around the mouth. Vesicles are going to be seen in and around the mouth. That is what is important for vesicular stomatitis virus. Okay, after being in the mouth, then it can go to oropharynx, it can also go to brain, then it is endless, it can go to many places, but that's the primary thing. But before I end, where else did you study about sandfly? Let me ask you, अब यहाँ पर तो in terms of viruses you can write vesicular stomatitis virus, which is right in front of you. But do you also remember one thing from bacteria? Do you remember something called Bartonella? And I gave you a mnemonic also that time. Bartonella bacilliformis. Bartonella bacilliformis. Why have I written it like this? Because I had told you SF was standing for sandfly, and OR was standing for Oroya fever. It causes Oroya fever. That was our mnemonic. So bacilliformis causes Oroya fever and is transmitted by sandfly. And finally, you can never forget the parasite Leishmania, Kala Azar. Leishmania or Kala Azar is also going to be via the sandfly. That is very important. So basically, अब no mnemonic needed. One virus, one bacteria, one parasite. सब में one है क्या mnemonic? Kala Azar, everyone knows sandfly. For bacteria, Bartonella bacilliformis, I have given you the Oroya fever का mnemonic. And in terms of the virus, we have had the vesicular stomatitis virus. हो गया. So that marks the end of the Rhabdoviridae family also. And we are sorted with this. And like I said, it's a good recap of integration with PSM that I've tried. If you want and you have time, open up your PSM lecture, community medicine, finish it off from there, and this will be like totally done for you. Thank you.